Every year, millions of people experience heart attacks, but many don't recognize the signs until it's too late. In the next 9 minutes, we're going to walk through the 7 silent signs, emergency protocols, and advanced tips for a long life. A heart attack, or myocardial infarction, happens when blood flow to the heart is severely reduced or blocked. This is usually due to a buildup of fat, cholesterol, and other substances in the coronary arteries. Sign number 1 is the most well-known, chest discomfort, but it doesn't always look like it does in the movies. It can be a sharp pain, but more often it's a feeling of pressure, fullness, or a tight, squeezing sensation. Watch out for discomfort that lasts more than a few minutes, or that goes away and then comes back. Sign number 2 involves discomfort in other parts of your upper body. Pain can radiate far from the heart. You might feel pain or discomfort in one or both arms, your back, neck, or even your jaw. If you have unexplained jaw or neck pain that starts suddenly, it could be a referred sign from your heart. Sign number 3, shortness of breath. This is a critical indicator that your heart is struggling. It often happens alongside chest discomfort, but it can also occur without any chest pain at all. When the heart can't pump effectively, it causes pressure in the lungs, making every breath a struggle. Sign number 4 is breaking out in a cold sweat. This is your nervous system reacting to cardiac distress. This isn't sweat from exercise, it's a sudden clammy perspiration that happens even when you're resting. Your body is entering a state of emergency, releasing hormones that trigger this intense sweating. Sign number 5, nausea, indigestion, or vomiting. This is a symptom often missed or misdiagnosed. Women are more likely than men to report these atypical symptoms, which can feel like severe heartburn. If your indigestion is accompanied by any other symptoms on this list, don't wait, get checked. Sign number 6, sudden lightheadedness or dizziness. This indicates a drop in blood pressure or poor circulation. You might feel like the room is spinning or that you're about to faint. This is a sign of reduced oxygen to the brain. Do not ignore a sudden loss of balance. It's often a precursor to a total cardiac event. Finally, sign number 7, unusual or extreme fatigue. This is a symptom that can appear weeks in advance. This isn't just being tired from a long day, it's a profound exhaustion that makes simple tasks feel impossible. If you feel this way for several days without a clear cause, your heart might be trying to warn you. Now, if you recognize these signs in yourself or someone else, you must act instantly. Here's the protocol. Call your local emergency number immediately. Do not hesitate. Every minute saved preserves heart muscle. Never drive yourself or the patient. Paramedics can begin life-saving treatment the moment they arrive. While waiting, chew, don't swallow, 1 adult aspirin. Chewing gets it into your bloodstream faster to thin the blood. Loosen any tight clothing and stay as calm as possible to reduce the workload on your heart. The best way to survive a heart attack is to prevent one. Let's look at the lifestyle actions you can take today. First, your diet. Focus on healthy fats like those found in olive oil and fish, which protect your arteries. Reduce your sodium intake to lower blood pressure and swap sugary snacks for fiber-rich fruits. Next is physical activity. Your heart is a muscle, and like any muscle, it needs regular exercise to stay strong. Aim for at least 150 minutes of moderate activity per week, like brisk walking, cycling, or swimming. Don't forget strength training twice a week. It helps improve metabolism and overall cardiovascular efficiency. We must talk about what to avoid. Smoking is the single most destructive habit for your heart health. It damages the lining of your arteries and increases the risk of dangerous blood clots. Quitting now starts the healing process. Also, limit alcohol. Excessive drinking can raise blood pressure and contribute to heart failure. To live a long life, you must be proactive. That means regular checkups to monitor your vital statistics. Keep your blood pressure in check. High blood pressure is a silent killer because it often has no symptoms. Understand your cholesterol levels. High LDL or bad cholesterol is the primary builder of arterial plaque. If you have diabetes or prediabetes, managing your blood sugar is essential to protecting your vascular system. To really maximize your years, we need to go beyond the basics. Here are 3 often overlooked tips for heart longevity. First, stay hydrated. Proper hydration helps your heart pump blood more easily through the blood vessels to the muscles. Second, don't ignore your teeth. Chronic gum disease is linked to an increased risk of heart disease due to systemic inflammation. Finally, maintain a healthy weight. Excess weight, especially around the midsection, puts significant strain on your cardiovascular system. Longevity isn't just about the physical, it's about your mental well-being too. Chronic stress is toxic to the heart. Incorporate stress-reducing practices like meditation, deep breathing, or yoga into your daily routine. Strong social connections and a positive outlook are scientifically linked to a lower risk of heart disease and a longer life. Never underestimate the power of sleep. This is when your heart rate slows and your body repairs itself. Poor sleep quality is linked to inflammation and high blood pressure. Prioritize 7 to 9 hours of quality rest. These 4 pillars, diet, exercise, sleep, and stress management, are your foundation for a long, vibrant life. Let's recap what we've learned today. Knowledge is your most powerful tool against heart disease. Remember the signs: chest discomfort, radiating pain in the arms or jaw, and shortness of breath. Cold sweats, unexplained nausea, sudden dizziness, and overwhelming fatigue. Don't ignore them. If you see these signs, call for help immediately. Don't wait for proof that it's a heart attack. You have the power to change your story. Start with one small, heart-healthy action today. If you enjoy these videos, please hit like and subscribe for more health and preventative information to live a long and happier life. Thank you for taking these 9 minutes for your health. Stay safe and take care of your heart.